I'm Francis Mwesigwa, working at Freedom and Rome, Uganda. I work as the administration officer and sometimes as the DIS coordinator. The nearest health center is, I think, Chira. No, I haven't had the chance to receive any services. Why? I don't feel comfortable going to Chira because, to me, I've not had the chance to engage so much with the health workers that work there. And I don't feel there is so much that I need to get from there, any service I need to get from there that I can't get from maybe Mulago or any other facility. I've had medical issues, and since I have an insurance card, I usually use them on private facilities, mostly not government facilities. So I've really had a big challenge accessing these services from those centers, of which I will not mention names, but presenting the insurance card, it has my dead names. I forgot to say I'm a trans person, a trans man. So when I present my insurance card, it has my dead names, and the names I present now that I have are not the same names that are registered on the card. So I've had issues of, going through thorough checkups, body checkups, to prove if what I'm saying is true. The facility I know specifically is in town. Where I went, I had a serious issue. I had to see an endocrinologist. So I was denied the service. I had made an appointment with a doctor, but the receptionist, when I gave in my insurance card, kept on saying, "This is not you. I'm seeing a different name, and I'm seeing a different person." Luckily enough, there was a nurse who knew about transgender issues. So he tried to explain a lot to the receptionist, but she insisted on saying, at first she said the doctor was in, but when I presented my documents, later on she was like, the doctor is not in. So I was denied the service, however much the nurse tried to explain a lot. I ended up not to cause a lot of chaos and attractions. People come in and ask what is going on. I just had to leave, and I never got that service. But I would have received a better service, thinking if they were maybe sensitized enough, because I believe the person that was there that knew about these issues was not using that opportunity to explain to them these issues. Because if they knew and had an idea about it, it would have been easier for me to receive the service. But because they weren't sensitized enough, I wasn't able to receive the service. This kind of person who rarely gets issues. I have a background of medical background. So I think I do most of self-treatment. I think that is why I don't usually go to these facilities. And at the back of my mind, I'm always like, the fear of, going through all these processes makes me think I can do much for myself than going, just because I have the knowledge, I can do that for myself. So I haven't had the chance to go through all. Where I work, we have a DIC. Though we do not have stationed health workers. But at least we do have people that I work with that have medical background, so that I think we are safe. And it's easier when you go through this DIC, we get referrals, we work with the government, some government facilities. So I think it's more at where I work than where I stay. One-on-one interactions with the health workers, and it's more like me educating more. on issues concerning what transgender person have to go through and lesbian women. I've had a challenge that it takes me hours to explain. You see that these health workers want to know more, and there are those that are just living with bias. They pretend to be, working with you, but in actual sense they are biased, and when you leave, you become like the talk of the day. And by the time you come back, though sometimes there are challenges that the more you sensitize these people and you get to, interact with them, we get challenges that they are sometimes transferred. So you go to a facility and you're specifically looking for a specific doctor, which is not supposed to be like that. We want to look at a facility and where doctors can easily be accessed, whether they are transferred or not. We want a service. We don't care which doctor or which service provider is there, but challenge is now clients come in looking for specific persons, which is not the right thing to do. We want a facility which is accessible for everyone, and every doctor or health worker has the knowledge about issues concerning LGBTQ persons. So I have been a health worker for over 13 years, and yes, I've interacted with a number of LGBTQ persons. I'll look at first the lesbians. They need access to, cervical cancer. They need access to cervical cancer screening and breast cancer screening. They need what else? For transgender persons, they need mastectomy, which is pretty hard to access. For bisexual women, I believe they need general services as any other person in the heterosexual world, because they are human beings. I don't see the difference where heterosexual persons can get services which LGBTQ persons can't get. They are ladies, they still need the service as a heterosexual woman. So I don't see a big difference. Access to safe abortion, as you said. I'm also looking at access to the fertility. I don't know specifically how to call it, but easier for an LGBTQ person to go to a facility center and get inseminated with getting a donor, because also LGBTQ women are parents. They want to be parents, however much they are not getting involved with men. I'm looking also at it as access to HIV is a general term. That's where most people are looking at it. Because yes, I know we do get services for HIV as LGBTQ persons, but as long as you don't identify that I'm a lesbian, it's easy for you to get that service. But as long as you identify, bias, stigma, all that you're going to face that. When it comes to transgender men, it is so hard for a transgender man to walk into a facility and, or maybe you're walking somewhere and you're going to ask for a pad. It scares them. You're like, you're a man, and then you're asking for a pad. Do transgender men go get periods? It's normal. This is a transgender man who has organs for a woman. It doesn't mean that because they identify as a transgender man, they still don't get periods. They do. Abortion is in general. It is not just for lesbians or transgender. As long as you are a human being holding with organs that specifically are meant for women, and you can't get pregnant, you have a right to access to abortion. There are normal people who have feelings. We get wasted at times, and you end up sleeping with someone and you get pregnant. So they have a right to get this service in case they walk into your facility. But for the government, it is illegal. Yet they can do that for a child who has been maybe raped or defiled by maybe a parent or someone or some other person from the family, it is easier for them to do that. Why not for a person who is grown up enough to decide for themselves? I believe the services should be free, because when a person comes to a facility, they need help. And if and the motto of a health worker is save a life. That is the motto for a health worker. You are supposed to save someone's life. But mostly people look at money. If you do have money, you can get a service anywhere. They don't even want to know whether you're a transgender person or you're a lesbian or what. But if you come in, but I believe this service has to be free for everyone. It has to be accessible at any time, any day, and any hour. We need like dental dams, dildos if they possibly can provide them. This thing of using lubricants and condoms. And by the way, also female condoms, they are nowhere to be seen anymore. They brought them once, and now they are out of stock. So I don't even know why they can't look at females and respect them and respect their needs. They are the parents, the mothers of the nation, who should be put first. Finger condoms, guys, really, not really. This is my personal thought. Giving a medical, this one allow me to go take it on a personal level. Finger condoms, I have had a lot of questions on how with the medical workers personally that I've tried to interact with. Like someone getting a polythene bag and they put it on their finger, as in they're trying to demonstrate to you how a finger condom looks like. And then you're like, man, you don't have a clue even at how a finger condom looks like. So I have had a lot of challenges, with explaining finger condoms to people. So on a personal basis, lesbians do need them. Health service providers, first of all, need to learn, unlearn, and relearn all the issues concerning SRHR for the LGBT community. Two, they need to learn to create friendships. We are not different. We are human beings. Allow to put aside the bias and give a service to any person who needs it. When I come to you, respect me the same way I'm going to respect you. We are not so special. All we ask for is to be loved, cared for, and be given a service at any time. And they should learn to sensitize others. Those that have had the opportunity to meet these communities and engage with them should learn to push forward the message. Take it even out of, the centralized system and take it to maybe up country. Go to in case you transfer someone to a certain facility from Kampala, maybe to Gulu, encourage them to keep teaching others about these people's issues. For the community organizations, I believe they should just add in efforts and focus also on engaging the financial systems, like banks. Let them engage banks, let them engage telecommunication companies, because when it comes to transgender persons, if you transition fully and you go to a telecommunication company that has no information about this community, that means you're going to find a lot of challenges. I have had those challenges, and I wouldn't want any other person that is just like me to go through the same situations. So getting to, besides health, because we focus so much on health, but let's learn to engage other stakeholders. The government should just ensure that they improve on their policies. We've tried so hard to engage the government, whether parliament, whether any government body that has they tried so hard to interact with them, but they just push us away. Let them focus on changing their policies. The things that they think are illegal, they just don't know what is going through our minds. Let them pull us closer to them. Let them understand us. Some of them are our families. Some of them are our parents. Some of them are just our relatives, but they should learn to think of where they come from. They should think of the children they have, because they may not understand them better. Let them change the policies they create every day that incriminate the LGBT community. That is why we are lacking even to get these services, just because of their laws. Every day they keep changing laws just to incriminate us. But we are human beings. We beg the government to focus and think from their grassroots. If this was my child, would I wish them bad luck? Or would I wish them to be healthy, living with a healthy mental well-being?